We're back. Monday, 10 o'clock. Welcome back, guys. We got a few people in. If you want to say hello, drop us a message in the comments section. Uh, cool. Stevie on the road. Are you heading down now? Or are you leaving it till tomorrow? So Stevie is up in Scotland and coming down to the Therapy Expo in Birmingham on Wednesday and Thursday this week. And I was on a podcast with Stevie the other day for the Sports Therapy Association, and we had a bit of a chat about the people to see and all the kind of bookings that you make. So if you've not heard of the Therapy Expo before, years ago it used to be a an event that was free. And then if you wanted to go and attend any of the talks, then you had to pay for the talks you wanted to see. And then what they did, they switched it, so they upped the price for entry, and then you could see whoever you want. And I think that's a much better way of doing it. You can do 2 days worth of CPD training. I think it's about 170 quid for the 2 days. So it's and yours truly is there. I'm with the Rock Tape guys and also with the Sports Therapy Association. So be a busy couple of days for me. So hopefully, if you are around, then I will see you there. Um, First time I've been able to make a live one. Cool. Well, welcome. So I am able to put your. If you've never seen this before, I am able to put your messages up there, and I can see your images and who it is, because there is a little link on the show advert, which is a little link for Ecamm, and if you click on that, then it gives Ecamm the permission to use your picture only for this session. Obviously, they're not allowed to take your details or anything like that. It's literally so I can see who is making comments. Otherwise, I see this. Okay, a Facebook user. So thank you, Facebook user, and welcome to your to the live show. You've picked a good one to come into. Currently in the I guess someone's currently in the services. That means to tune in. Okay, good. Grab yourself a sausage roll from Greg's and sit down and relax. Okay, we've got Julie here, who's one of our movement therapy diploma students. Morning, Julie. If you've not heard of that before, we teach a therapy diploma course that is taught over 3 years. Very similar to a degree program, but without going to university. So, and this is, well, to be fair, I used to teach anatomy on a degree, sports therapy degrees, and we didn't really go into the detail that we go in with you on this. So we probably stopped maybe a couple of weeks ago. So this is session 6, I think, for the foot. So we would have done nearly six hours of anatomy lectures on the foot. Obviously, if you did that all in one go, that would be that would be some session. But we split it up over the weeks, so it's about 45 minutes each session, and we break down everything over the weeks. And this week, I put down the nerves and the blood supply. But as I was putting it together, I was thinking, I think we're only going to get the nerves done today because there's a lot going on. And I don't want to bombard you with too much information that it kind of goes in one ear and then out the other. If the way that this works is we layer the learning on. So if you have missed a few sessions, by all means stay with us. It's not a problem at all. But don't get freaked out if you're thinking, I have no idea what's going on. Because there will be some things that we'll refer to in this session that have been covered in previous sessions. So if you're thinking, I really haven't got a clue and this isn't for me, don't worry about it. That's not the case. Just go back a few weeks and watch those episodes, and then it will lead you into this to this session. So yeah, we're going to cover the nerves today. Waiting, is this me? Oh, so morning, Becky. Morning. So my screen keeps popping up with waiting for the live signal. Is this me or you? I have no idea. I'm afraid. I don't know. And Alex. Okay, cool. Yeah, so Alex is coming up to see us in Birmingham today, so that would be good. Yeah, good to see you, mate. Looking forward to catching up. all the pleasantries done. Here we go. So yeah, we're going to be looking at the nerves, and one of the reasons why it's important to do the previous sessions is because a lot of the nerves are named after these. They're named after the bones that they relate to, and in the leg and the foot, well, especially the leg. So in anatomical terms, I say this again. So this is the leg, and then the femur is the thigh. Okay, so that's how we split it up. And in the leg, there are compartments, which we've looked at a few weeks ago now, 4 weeks ago. And those compartments are all divided by fascia. So this connective tissue that separates each area. And then the nerves then go into those compartments and then innervate or turn on the muscles. So sometimes the nerve is shared between compartments, but there usually is a predominant nerve for the compartment. So that's really useful if you're a therapist and you're doing assessments on people, and you notice that they struggle with certain movements, and they just can't they can't do them basically, so they're not able to provide a resistance against a specific movement. So you'll be able to ascertain which region or which compartment may be contributing to that problem, and we'll talk about a clinical example as we go along. Okay. No, I'm afraid not. That's all I can see. Yeah, apologies. I can't see who you are. I could just see its Facebook user. So sorry about that. But in the show notes, you might have to do it before it starts. I don't know. But if there's anybody else who's had problems with this in the past, or logged in after the show started, then if you could just drop a message just to help them out, that would be brilliant. If you wouldn't mind doing that, that'd be great. You can still join in. Just pop your name on the end of the message, and then I'll know who you are. It's Penny. Okay, cool. Yeah, no problem. Yeah, so you might have a setting on your computer that resets it every time. It doesn't allow cookies. So if you've heard of those, so that might be the problem. Just put P on the end, and I'll know who you are. Cool. So let's get going then. I just want to show you this PowerPoint. This is one to look at now and go, what the hell is going on? And then after the session, go, okay, I get it now. And so this is, you can pause this and you can use this as revision. So there are specific colors, okay, and we mentioned these colors last week. And there are, and then the colors are related to the compartments. Okay, so if we have a look, just grab my arrow a second. So if we have a look here, this is the superficial posterior compartment of the leg, containing the gastroc and soleus. Then you've got flexor digitorum, flexor hallucis, and tibialis posterior, and that is the deep posterior compartment of the leg. And then the fibularis or peroneal muscles, that's the lateral compartment, so they also help to evert the foot as well as plantar flex. And then extensor digitorum longus, that's part of the anterior compartment. Okay, so all of these are color coded to help you work out which compartment they're in. These are the movements that they contribute towards. And then these underneath here, if it's got an N on it, that's the nerve. Okay, so we're going to talk about the nerve supply in a second, so you can see which nerves innervate which muscles and which movements. Okay, and then the ones with A on the end are to do with the arterial supply. So when we get to the blood supply, then that will start to make sense as well. Okay, so this should be a bit of a one-stop shop for everything to do with the ankle and the foot. And it will give you an idea that, okay, so if they're struggling with plantar flexion, it might be one of these muscles, or it may be the nerve supply to those muscles. And then you can track back and kind of work out what's going on if that's what your qualification allows. Okay, so so that's today. Cool, thanks Becky. So I had an issue a few weeks ago, just went to the eCam link on one of the files in this group. Great, yeah, it's usually the case. If you click on that again and then go through that registration process, then you should be able to get on. Cool, right, let's have a look at this. So this is our first one. Let me just pause that there before we go any further. We're first of all having a look at a nerve called the deep peroneal nerve, okay? And sometimes it's called the deep fibular nerve. And it's because we're in anatomy, they're renaming this outside part of the leg because this is where your fibula is. And previously this area was the peroneal area. But they're trying to change the muscles now in anatomy textbooks. So it's fibularis muscles, so fibularis longus and brevis, and then the fibularis nerve. Okay, so if you see deep and superficial fibularis nerve, it's exactly the same as the peroneal nerve. It's just they're trying to change the name of it, and we've kind of we've used the names together in this presentation as well. So it's going to be a bit of a slow transition, I think. Let me just get rid of that ticker. There we go. Cool. So just to give you a bit of an orientation, this hopefully you'll be able to get an idea of where it is. So we're looking at the front of the leg. Okay. So the kneecap will be up around here. This is the nerve. So this is what nerves look like. Okay, so they're they're quite white, and they are. They don't have much give. They've got a little bit of give, but not too much. And I do relate this to food quite a lot, but it's the only way I can describe it really. But I obviously haven't done this, but they look a bit chewy, a bit as if they'd be like a bit like a squid. Okay, and yeah, a bit kind of calamari like. And so that's the kind of consistency of it. That's what they look like. And this one here is really, really close to the surface of the skin. So you can see here, these are the muscles of the leg. And we'll go through what muscles they are in a sec. And you can see the fibula or the peroneal nerve. It is really, really close to the surface of the skin, and it actually wraps around your fibula head. Okay, just around there. So, if you knock the side of your leg, and the classic is knocking it on something like as you're trying to squeeze past cars in a car park, and then the bumper is just at the right height to kind of, well, depends how big you are, how tall you are, but just at the right height usually to kind of knock that fibula head. And if there is an insult to the nerve there, then it will affect all of the muscles that the nerve supplies. Okay, so and we'll go through those in a second. So the nerve doesn't obviously start here, and as we work up the body, we'll go to where it comes from. And but the origin of this nerve is from L4 to S1. And if you've not heard of those numbers and letters before, so L is to do with the lumbar vertebra, and then S is to do with the sacrum. And so L4 is it's L4, L5, S1 is where the origins of this nerve comes from. Okay, so we've got those regions there. So it supplies the anterior compartment, and we've covered that previously, plus some muscles of the foot, some of the intrinsic muscles of the foot, and we'll have a look at that in a second. So let's have a look at this. So I mentioned a little while ago, let me just rewind that. When we were looking at around the peroneal muscles, the fibularis muscles, there was a little gap, okay, on the fibula, and I said to remember that for now, and this is why, is because in between that gap is where the nerve supply goes, so that it can get to the anterior compartment. Okay, so and it's called the fibular tunnel. So there's a little tunnel there, goes underneath fibularis longus or peroneus longus. And then underneath there as well, so under extensor digitorum, and then into that anterior compartment. And I don't know whether you can see it there. It's quite a dark picture. This is your tibialis anterior, just at the front, and then it runs all the way down there to the front of the ankle. And there's your retinacular. So these are the muscles. Let me just pause. Oh, I can't pause it. Hold on. Just move that. So these are the muscles that the nerve will supply. So if we have a look at this picture, this is where it comes from. So it's part of the sciatic nerve. So you've probably heard of the sciatic nerve if you've not really studied anatomy before. But the sciatic nerve is not just one nerve. It's made up of two nerves. There's your common peroneal nerve and then your tibial nerve. And it's sometimes it's two really, and it's split really high. So you can actually have like two sciatic nerves running down the back of your leg. Usually though, they're wrapped together, and there's if you've studied muscle anatomy before, you might have heard of endomysium, perimysium, and epimysium. Is the connective tissue around the muscle fibers. It's exactly the same in the nerves. So we've got an endoneurium, and then a perineurium, and then an epineurium around the whole thing. So we've got this connective tissue wrapping around the nerves, and it bundles the sciatic nerve together. So it's usually two, and if you do dissection on it, you can separate them out all the way back. Usually to piriformis kind of area. Sometimes it splits around piriformis, which is in the buttocks, but we'll talk about that when we get to the hip. And you've got these two nerves that are bundled together as one sciatic nerve, and then it splits around the knee, okay, usually, but sometimes a little bit higher. And when it splits, it is then the tibial nerve and the peroneal nerve, or the fibularis nerve, whatever you want to call it. So if we have a look here, this is the sciatic nerve, this is the femur bone, and then it splits around here. So this is where it's coming off to the side, and this is the one we're looking at now. And then that's your common peroneal nerve, and then that then splits into two. So it splits into a deep nerve and then a superficial one. So deep means obviously it goes deep, and then superficial, it's on the skin. And it splits, as you saw in the video earlier, around the fibular head, so around that area there. So it's very close to the skin as well. Okay, so there's your peroneus longus muscle, which was the one we just looked at, and that's the one that's got the gap in it, which is the fibular tunnel where the nerve goes through. Okay, so it's just here. There's your fibular tunnel, just through there, and then that will dive then into the anterior compartment, and it will supply tibialis anterior, which is the muscle that we just saw, and then your extensor digitorum, which is for your digits, and then the hallux extensor hallucis, which is for your big toe. Okay, the superficial peroneal nerve supplies the lateral compartment, and we'll have a look at that in a sec. Okay, so we'll let's just show this one. So these are the muscles that it supplies. So tibialis anterior, if you have a fibularis tertius, it'll supply that one. Just move me out of the way. So the deep fibular nerve, the one that goes forward into the anterior compartment, has also got a sensory portion to it as well. So the nerve is usually, it can be one or the other, or mixed. Okay, and this one is mixed. So it's got some motor nerves that go and supply the muscles, but it's also got a sensory nerve that supplies that little bit there. Okay, so if someone comes in and they have loss of sensation in the web space in between their first and second toe, they have probably done something to their deep fibular nerve. Okay, so that's a bit of a clue, and they may have issues, depends on where the problem is, with the with dorsiflexion of the foot and lifting the big toe, because that's what that nerve does. So if you think about the anterior compartment, all of the muscles it supplies with the tibialis anterior, so dorsiflexion, flexor hallucis, extensor hallucis, sorry, and extensor digitorum. If there's a problem with the nerve there, then you're going to struggle lifting the foot. Okay, and you have something called drop foot. So if these muscles can't contract and you can't dorsiflex the foot, then you have a bit of a floppy foot, and it can catch on the floor and then make you trip up. So that's again something to look out for, and you can do muscle testing for those particular muscles. So there's some clues, like clinical clues, if there are issues with this nerve. I'm just thinking, I love the way you've stopped at the services to to watch this. This is brilliant. Right, okay, let's have a look at the next one. So this one then is the other bit of that nerve. I'm just going to rewind it a bit. So we had a look at the deep perineal nerve. So that was wrapping around the fibular head and then diving into that anterior compartment. We're now going to have a look at the other branch of that, the superficial perineal nerve. So let's have a look at that. Here we go. Okay, so the superficial perineal, L4S1, because it's the same area that it comes from, because it's still that branch off of the common perineal nerve, and then it splits into two, and it supplies the lateral compartment. So this is the fibularis muscles or the perineal muscles. Okay, so you've got one going to anterior and then one going to the lateral compartment. So it splits off into the two. So this is useful because we know that these muscles help with eversion. So if you struggle with eversion of the foot, then there may be an issue with your superficial perineal nerve. Okay, let's have a look at this. Just pause that a second, just go back. Loads of stuff going on. Okay, I've tried to label this up as best I can so that you can pause it and then have a look at things and check with your anatomy textbooks and then come back. So this is the fibular tunnel. So this is the nerve coming through. Common perineal up here, and then it splits into the deep and then into the superficial. So this is the deep one here. There's your fibular head, and then I am covering the patella. So there's your patella, there's your kneecap. Okay, so let's have a look at the next bit. So there's your extensor digitorum, and then it's we're going to follow now the superficial nerve. So there's the deep one. If I just pause that there. So there's the deep one there. So you can see that coming down there and then going through that tunnel and then into the anterior compartment. And then this is the superficial one here, and that's going to run this way. Okay, there's your common perineal. So that's where it's just split just there. So remember, it's tibial and common perineal form your sciatic nerve. All right, so they come up a little bit higher. So let's have a look where it goes. So we've got some superficial branches just there, and that will be useful for later when we have a look at the sensory supply. So these are the muscles that the superficial perineal nerve innervate. Okay, so muscles supplied by the superficial nerve. So we've got fibularis longus or peroneus longus, so that's in the lateral compartment. And then, if that'll work, no, let's do this one. And also fibularis brevis. Okay, so the long and the short one. And then this is the distribution of sensation from that nerve. So remember, the deep perineal only supplies that bit there. I mean, there's going to be some crossover. Okay, it will supply some other areas, but the predominant area where the deep perineal nerve supplies is here. The superficial is all that side of the outside of the leg. So that's all down the outside of your shin, basically. Real classic place if someone has a disc herniation, L4, L5, L5S1. Classic place for a disc herniation. If there's any kind of compression of that nerve, then you can get radicular symptoms down the leg, so radiculopathy. And you may have motor or sensory loss, and the sensory loss will be in this area here. The motor loss, depending on where it's affected, may be into eversion because it supplies that lateral compartment. So all of this region here is superficial perineal. So sensory distribution of the superficial perineal or superficial fibularis nerve is down there. Okay, so that is that one. Let me just see if there's anything else on that video. I think that might be it. Yeah, that's it. Cool. Okay, so now we're going to have a look at that lateral nerve. So the common perineal going into the deep and superficial, and we've seen it go all the way down to the ankle. Now we're going to have a look at it going into the foot. So this is it in the foot, just here. Okay, so superficial peroneal nerve is this one, and you can see it is really superficial. So that is literally, they've taken the skin off, they've taken the subcutaneous fat, so the fat that's just underneath the skin, and then this is what you see. So this superficial peroneal nerve is really, really superficial, and sometimes it's palpable. So, and then it goes down onto the dorsum of the foot, and that's where it provides sensation. So it provides sensation all around there as well. So remember the picture from before where it's up here on the lateral part of the shin. It also provides sensation for the lateral part of the foot. Okay, so you've got a motor branch that goes into the lateral compartment, and then a sensory branch which then comes into the foot and supplies the skin on the outside of the leg. Okay. And then this is the deep peroneal nerve. So if we just give you a bit of an orientation here. So this is extensor digitorum. So we've looked at this before. So you can see the tendons going off there for the branches off to the toes. This is extensor hallucis. So that's the long tendon that goes to your toe. And then that one there is tibialis anterior. So that will go down just underneath the foot into the navicular. And then you can see the deep peroneal nerve here, and there's an artery there which we'll have a look at next week. So let's have a look at this. Yeah, just pause that there. So again, I'll try and pause these whenever the arrows are on, so you can pause the video and just get your head around where everything is. So extensor hallucis is that one. Extensor digitorum longus is that one. Okay, that little one there coming through there, that's your extensor hallucis brevis, and we looked at that last week. Just pop that there. There we go. So just like the superficial peroneal nerve, where there were motor branches and there were sensory branches, the deep peroneal nerve also has some motor branches that come off and supply some muscles in the foot. Okay, so we've seen it supply part of the anterior compartment. As it comes down into the foot, it will also supply some muscles in the front of the foot as well. Okay, so let's have a look at those. Here we go. So these muscles here, you can see that one there. So that's extensor hallucis brevis. This one here, extensor digitorum brevis. So brevis means short. These are the long ones. This one there and that one there, and then these two are the short ones. Okay, so they only act on the toes. So it supplies extensor hallucis and the digitorum brevis. Okay, as it comes down into the foot. So that's motor branch, and then we've got a sensory branch that supplies that web space in between the toes. Okay, so that's what we saw earlier. So this is just a zoomed in version. Okay, so that's your deep and superficial peroneal nerve in the front of the foot, so into that anterior compartment and into the lateral compartment. All right, so one nerve, common peroneal, splitting into two, and then with branches off of it as well. Okay, next one. Okay, so we're going to have a look now at the back of the leg. I'm just going to pause that there. This is another one where I'll pause it just so you guys can pause it and then again get your head around it where everything is. So if we have a look here, this is what I was talking about before. So this is the sciatic nerve. Most people have heard about that. So that's up there. These are your hamstring muscles there and there. Okay, so you've got lateral hamstring muscles and medial ones. We'll talk about that when we get to the knee. This is when the two are together, is the sciatic nerve. When they split, we've then got the tibial nerve, which comes down the middle. So this is the back of the knee area here. And then there's the common peroneal that we were talking about. And then remember, that common peroneal then splits into the ones we've just seen. So we've got the superficial branch and then the deep branch as it splits through. Okay, sometimes it looks, it's in different places on different people. These muscles here, those are your gastrocnemius muscles or your calf muscles. So this is the lateral gastroc, and this is the medial. And the reason why we know that is because that is the peroneal nerve. So this has to be the outside of the leg. Okay, so let's just play that. So now the gastroc muscles have been taken off. Okay, so we can see underneath those. And then you'll see this. That doesn't look like a nerve, and it's because it's not. That is your popliteal artery. So it's the artery behind your knee that you're told to be careful of whenever you're treating around that area. And then that is your tibial nerve. Okay, so it runs right close to your popliteal artery. This muscle here is your soleus muscle. So in that superficial posterior compartment, again, which we've covered a few weeks ago, that muscle there, that's your popliteus muscle. Right? And again, we haven't really covered that much because we've been looking at the ankle and the foot. But when we come to the knee, we'll be talking about that in a bit more detail. So that there is a little gap in the top of the soleus where the blood supply and the nerve supply go through. Okay, so there's a bit of a gap in there. So let's have a look at that. So they'll take off the soleus in a minute. There we go. And now we're looking at the back, so the posterior aspect of the deep posterior compartment. This is where you need to get your head around the where all the compartments are. So there is your tibial nerve. Okay, running all the way down there. So it's behind your gastroc muscles and your soleus. So it's quite deep in the middle of your leg. Just play that again. There we go. So there's your tibial nerve, and this is where it goes to. So remember, when we were looking at the muscles and the tendons, we had Tom, Dick, and a very naughty Harry, all on that inside ankle bone. So that inside ankle bone is your medial malleolus. So Tom was tibialis posterior. Dick was flexor digitorum longus, okay, because it's the long one that flexes your toes. And then and is nothing, and then that's why I've put the A in capitals, because that's the artery. Okay, and we're going to have a look at the artery later. And then very is the vein, and then naughty is the nerve, and that's the tibial nerve, which we've been following down from the knee. Okay, and then Harry is flexor hallucis for your big toe. So those are all the structures that are on this inside of your ankle. Okay, in this area, because the structures are really quite superficial, you might have heard of something called tarsal tunnel syndrome. And if there's an issue around the ankle here, swelling in that space, then it can compress the nerve, and then it will make your on this side, it will make your foot go all funny and feel numb. Very common with cyclists, and especially if they've got quite new shoes, because it can really compress around that retinacular area. And so it may be a footwear issue, but there may be an injury and swelling problem as well. But that's quite common. So you've heard of carpal tunnel in the wrist. You can also get tarsal tunnel in the foot as well. Okay, let's just play this through. So there's the retinacular. So we've talked about that a few times. And there's the Tom, Dick, and a very naughty Harry coming through that retinacular. And then we're going to have a look at what the tibial nerve turns into. Okay, because it turns into another nerve. It's exactly the same bit of tissue, but depending on where it is, it gives it a different name. Okay, so we'll have a look at that next. So there's the retinacular. It will pass through there and go down into the inside of the foot. There we go, and there it is there. Okay, so I'll just show you this. So the tibial nerve splits around the ankle, so around that point where the retinacular is, into the medial, so the inside, and lateral, outside, plantar nerves. So they supply the bottom of the foot. Okay, so the tibial nerve coming down from the knee, okay, underneath your gastroc, underneath soleus, so they've been taken away so we can see it. It comes all the way down underneath that medial malleolus, and as it comes underneath there, it will split into two, one on the medial side, so the inside towards your big toe, and one on the lateral side towards your little toe, right? But on the plantar surface. So we'll have a look at that in a bit more detail in a second. So there's your lateral plantar nerve. And these things are really small at this stage. So these are the muscles supplied. So gastrocnemius, so it will supply your calf muscle. Plantaris, which is a really small plantar flexor. We covered that a few weeks ago. Popliteus, which is in the knee, so we haven't covered that yet, but it supplies that area as well, and we're in that region, so I thought I'd mention it. And then your soleus muscle, okay, which is the big one underneath your gastroc. The other muscles, so this is the superficial compartments now, the posterior superficial and deep posterior compartments. So the tibial nerve will supply all the back of the leg, okay, so all of the muscles that pretty much plantar flex and invert your foot, okay. So if you have a problem with plantar flexion, it could be to do with the tibial nerve. So it also supplies Tom, Dick and Harry. So your tibialis posterior, flexor digitorum and flexor hallucis. All right, so it's all supplied by that tibial nerve. Just play this through. Okay, so when you get down into the foot, and we'll have a look at this in a bit more detail in a second, because I've got a good video for this. When it splits into the median and lateral plantar nerves, it also supplies all of this. And I'm going to do a quiz next week and test you on all of these. Do you know what? If there was a quiz next week testing you on these, even I wouldn't get them all right, because I'm not an expert in great detail about the foot. I would expect a podiatrist to know all this stuff, and also if you have a real keen interest in specifically learning about the foot. But this is a lot to learn. I think the key thing to understand is the regions. So we know that the tibial nerve comes down and it supplies that bit and those. So what do those things do? Well, they predominantly flex the toes and plantar flex the ankle, and that's pretty good. Okay, so if you know that, then that's good enough for most things. Obviously, if you specialize in the foot, then you have to specialize in these areas. And this is the sensory distribution, because it also provides sensation for the plantar aspect of the foot. So we've got the medial plantar nerve here, so that supplies your big toe, and it's very, very similar to the median nerve in the hand. Okay, so it's a kind of half of that toe, and then there's your lateral plantar nerve, which supplies your the bottom of the foot and the little toe, and then your fourth toe. Okay, or half of your fourth toe. So these branches here, they come from the tibial nerve. So we've got motor supply and sensory supply for the bottom of the foot. Okay, cool. You'll be glad I didn't do the blood supply as well. You'll be glad of that. Okay, so now we're going to have a look in a bit more detail at the ones in the foot. So medial and lateral plantar nerves. Let's just go into those. So here we go. So this is what we've just seen. Just rewind that there. There we go. Okay, cool. So we're going to follow the course first of the lateral plantar nerve. So just to give you an orientation, your medial malleolus is up here. So that's your inside ankle bone. Your retinaculum was up here, and that's where your tibial nerve splits. Okay, there's your heel bone, calcaneus just there. So it splits into the lateral and the medial nerves, okay, plantar nerves. So let's follow the course of those. So there's the that's the lateral plantar artery, so don't get confused with that one. So it comes all the way underneath here. There it is there. So it supplies these muscles that we were looking at last week. So these are the intrinsic muscles of the foot. And there's a deep branch that supplies all your interossei muscles and your adductor hallucis. And then a superficial branch that supplies the digiti minimi. So also the sensation here. So sensation on the outside of the bottom of your foot. Okay, so and that's the picture that you saw on the previous video where you can see that distribution of the sensory nerves. Okay, so the lateral, obviously on the lateral aspect, and now we'll have a look at the medial. So let's just get that one up here. Here we go. So I'm just going to pause that there. Okay, so the tibial nerve splits. So we talked about that before. And then the medial plantar nerve comes down on the medial aspect of the foot, so around the arch area. Okay, some muscles have been removed here, so they'll be underneath a fair bit of muscles and connective tissue. So there's the nerve just there. It supplies your flexor digitorum brevis, so the short digits flexor. It also supplies your abductor hallucis, so we talked about that last week, the one that abducts your big toe, and also your flexor hallucis brevis, so the short flexor of your big toe. So the medial plantar nerve plays a big role in propulsion because of the flexion of that big toe. All right, so again, if you can't push your big toe down, you may have a problem with this nerve. And then it splits. Just move that there. And that's, I think this is a really good image of what your nerves look like. Okay, because again, we've seen them a little bit higher up, but this now you'll get to see what I mean about kind of calamares. So the medial branch of the plantar nerve then turns into the common plantar digital nerves. Okay, so it supplies all of the digits of the foot, apart from the little toe. Say little finger then. And you'll see the sensory distribution in a second. So medial plantar nerve supplies all of this area here. Okay, so all of them from that fourth toe all the way across and then up onto the instep of the foot as well. Okay, so again, if you've got sensation loss there, it may be the medial plantar nerve. Now, if I just rewind that a sec, I've had quite a few cyclists in with numb foot, and they go there, they're cycling along and they feel fine, and then once they're a couple of hours into a long ride, their foot starts to go numb. It's one of two things usually. It's either they've cut off the blood supply to the foot, so when they take their foot out of the shoe, does the feeling come back quite quickly? And if it does, then it's more likely to be a blood supply issue. If it takes a little longer for the sensation to come back, then they may have compressed the nerve, and that's more of a tarsal tunnel type situation. So it could be a little bit higher up where the tibial nerve splits, or it could be where the medial plantar nerve comes down and supplies the inside of the foot. Okay, so just some things to look out for from a clinical point of view. Okay, we're nearly there. We've got one more to go. Okay, now these are nerves that I don't think many people will have heard of before. So they are cutaneous nerves. So their only job is sensation. So remember I was saying before, we've got some that are sensory, some that are motor, and some that are mixed. So all the way through, we've seen a lot of mixed nerves. We've some that innervate muscles, so they turn on certain muscles and then they branch off and supply a bit of skin, and then they do some muscles again. These ones are purely sensory. Okay, that's all they do. So if we have a look at this, cutaneous nerves, so cutaneous means to do with the skin. So that's where subcutaneous is basically under the skin. So subcutaneous fat is the fat just underneath the skin. So we've got these branches here. So we can see the gastroc muscle. So these are your heads of your gastroc. But remember, the tibial nerve was deep to that. So it was underneath the soleus. So this is a branch of the tibial nerve. So there's like an offshoot that comes off just before it goes underneath the soleus and the gastroc. And then this one here, just there, that's a branch from your common peroneal nerve. So they both come together. So the common peroneal and the tibial both join together to form this sural nerve. So let's have a look at this. So just pause that there. So this is the sural nerve from the peroneal nerve, so this the peroneal portion of it, and then this is the one from the tibial nerve. So these are purely sensory branches, so they don't have any motor function, they just supply the skin, and we'll see the distribution of them in a sec. Let me just pop that there. Okay, so that's your tibial branch. So again, this is literally just underneath the skin. That's why they're called cutaneous nerves. And sometimes in people that don't have much body fat, you can palpate these nerves. You can roll over them. And here we go. There it goes all the way under there. Now this is your lateral malleolus. Okay, so that's your outside ankle. And this is the area that the sural nerve will innervate. Okay, so the sensory portion, there is no motor for this bit. Okay, so it'll come all the way down to kind of part way down that little toe. All right, so the peroneal and the tibial nerve combined then form the sural nerve that goes into the foot. All right, just play that a little bit more. So I've added these in. I just put that there. I've added these in from last year. We didn't cover these last year, so if you've seen some of the older videos, we didn't go into this much detail on the nerves, but I've been able to add some bits on this year. And then this is the last one. Okay, so we've got the saphenous nerve. And the saphenous nerve is on the medial aspect of the leg. So we're looking at kind of inside of the shin bones. There's your fibula. It'll be on this side here. So if you were to, so this leg is a right leg. Okay, so you're looking at a right leg. There's your patella. This muscle here is your sartorius muscle. So you can see it coming into the pes anserine area just there. And the saphenous nerve, purely sensory, again, so it's a cutaneous nerve, and it comes off of a nerve that we haven't heard about yet, which we will as we go into the knee. It's called the femoral nerve. Okay, so the femoral nerve is around the femur, and there's a branch that comes off that supplies the skin on the inside of the shin. So let's have a look at that one. Just move my arrows. This is the saphenous nerve from the femoral nerve. Okay, and again, we haven't covered that yet, so don't worry, we will do as we go through. So there's your sartorius, and it kind of just pokes through the fascia, and then it comes all the way down and supplies sensation there. Okay, so all on that instep, but on the dorsum of the foot. And that then completes the picture of the sensation for the whole foot. Okay, so if there is sensory loss in specific areas, then we can work out which nerve that sensory loss is coming from, because they generally supply common areas. There is some crossover, so you can't hang your hat on it and say it's definitely that, but if there's a sensation loss in a certain area, then you can start to narrow things down a little bit. Okay, this area again can be affected with an insult to that area. So if they've had a bang on the inside of the shin, and then they've lost a bit of sensation on the inside of the foot, you're thinking, oh my God, there's something wrong with their back. It might not be. It might just be the compression that they had on that saphenous nerve has knocked out the sensation on the inside of the foot. And depending on the severity of the insult, whatever's happened to them, then it may recover quite quickly, or it may take a bit of time. Depends on what's happened. But yeah, if it's that area there, then it's usually this saphenous nerve. Okay, just going to play that through. I think that's pretty much it. Oh no, last one. Yeah, so this one, this is the very last one, I promise. So this is another branch of the tibial nerve. So we have the tibial nerve coming down the medial aspect of the leg around the medial malleolus, and then it's split into the medial and lateral plantar nerves. There's one other little division as well, and this is just a purely sensory one, and a bit of the tibial nerve right up here supplies your heel. Okay, so let's just show you this one. So it's right in there. So branches from the tibial nerve right up there supply your heel bone. Okay. Let me just get that question up from Becky there. So if you had multiple areas with loss of sensation to the foot, it could suggest that the nerve irritation is further up the nerve. Yeah, that's what I would surmise from that. Yeah, and the way that I was taught how to do sensation checks, I think, is a bit flawed. Because we were taught to go along what we call the dermatomes, and I've done a session on that previously. If you've not heard of those before, have a look for dermatomes in the previous videos. Did it for the upper extremities. So the dermatomes for the leg, we'll look at that when we get to the lumbar spine. Okay, so we'll cover that in a bit more detail. But we were told to use like a cotton wool or sharp soft sensation, so a pin along the lines of the dermatomes, yeah, which are all kind of mapped out, but it doesn't really work like that. They're all a bit blurred. So what I tend to do now, something I picked up from a couple of physios, is rather than going down the lines and testing, I will go around the circumference of the whole limb, and I'll just do a sensation check around the whole thing to see whether there are patches that are missing. Okay, so because if I'm there, I might get some sensation, but if I'm slightly off, I might not, and I then get confused whether it's one particular nerve or whether it's another one, because there's a lot of crossover. But if you wrap all the way around, then you can really clearly mark out where the sensation loss is. Okay, so that just a tip. But yeah, if it's quite a wide area, so there's a number of nerves that are affected. You've seen now the branches of the tibial nerve, so the heel and the undersurface of the foot, medial and plantar. If the tibial nerve has been affected higher up, then it may affect the sensation for the whole undersurface of the foot. Yeah. So yeah, I agree with what you've said. Yeah. Cool. Good. Right. What time is it? Blimey, that was a long one. So those are all the nerves. Okay. What we'll do is we'll do a little bit of a recap session next week, and we'll add on the blood supply as well for definite. So we'll look at the arteries and the veins, because the veins are really important as well for varicosities. So you've probably seen quite a few people with varicose veins if you've been treating for a while. So we'll have a look at where the veins go and where the arteries go as well. I hope you enjoyed that. Nerves are tough. Yeah, they're really, really tough, and you need to know the other anatomy before you can kind of put the nerves on top of it. And but when you do know the nerves, it just makes things make a lot more sense. Okay, yeah, hopefully you find that one useful. I will be back next Monday, 10 o'clock. And yeah, I think I'm going to be on the STA chat again with Stevie, doing a bit of a summary of what the Therapy Expo was like. So if you go into the expo, I will see you there. Thank you for tuning in this morning, and I'll see you next week.